Now, feel how spacious you are from those 2 points. Now, open this just a little bit now. And then feel how I'm bringing this buttock skin down, but the front skin forward. Right. Now, don't even think here. Think about this skin going down, and feel how that invites a different phrasing of your core. And then float up. Float up. There you go. That's it.
My name is Emory M Moore Jr., and this is Exercise and Movement Techniques, and today we're at Movement Afoot with Leslie Powell, Pilates instructor, Lamon movement instructor, Franklin method instructor. What else did I forget?
Well, I've been a professional dancer as well, so.
Professional dancer. And I will say movement guru, because I used to take class from you. You actually introduced me to the physio ball many years ago. And as I was saying earlier, I will never forget your particular way of directing me that has gotten me into trouble.
Yes.
But it was effective.
Yes, that's it. That's true.
I would actually say that you were an incredibly effective teacher, and I love the way that you use imagery to get people. It's something that I always like to do, is tell a story. I feel like you tell a story. And you don't forget those. You know, you get to people and you don't forget it. I mean, years later I remember. So I think that's a big deal. So I say thank you.
Oh, thank
I really
you.
appreciate
Thank
that.
you.
So can you shed a little light on what it is that you do and how long you've done it?
Well, Movements Afoot is going to celebrate 20 years.
Big deal.
Big deal.
Very big deal. Please invite me to any celebrations.
It's going to be June 14th,
Okay.
Friday, so it's
All right.
already planned.
All right.
I started Movements Afoot 20 years ago. Originally, I was doing Pilates. I was teaching Pilates at a physical therapy practice, but I also was interested in bringing different somatic practices like the Bartenic fundamentals, yoga. I also had a lot of work with the physio ball.
Can you just get a quick definition of somatic? We've had another episode with a somatic practitioner, right. But I just want to make sure that people haven't seen that they have an understanding of what somatic is.
So somatic, the best way in most people's terminology is to think body-mind.
Okay.
And so, yoga is a body-mind.
Yes.
It's somatic as well.
Okay.
It's really about having, I think it's about learning about the body being connected, not like parts.
Sure.
It's also dealing with how you organize neurologically.
Okay.
And then how your habits sometimes get in your way, and how you repattern. And then as you repattern, you really are strengthening and creating better foundations for movement.
And I'll just clarify, repatterning essentially is if you have a particular habit that causes a problem or potentially may cause a problem. I think the hardest thing to do actually is for people is to repattern. It takes the longest time is to actually break a pattern that you're used to and install another pattern that's a better pathway neurologically.
And the hard thing to teach is that, I did abdominal exercises for years, and people are using their shoulders, they're using their necks, and that when
the hips,
the hips, is that when you start erasing those habits out of the way, it will get you in a whole different place.
Yes.
And a healthier place.
I agree.
Because a lot of people in fitness now think that killing yourself is fitness. And you can get away with that at 20, but you can't get away with that at 58. That's how old I am. I took a class once at a gym recently, a TRX class.
Okay.
I was so sore for 3 days, I couldn't lift my arms up.
But people think that's good.
Well,
some people think that that's good. They actually look forward to that, and they think that the more that they're massacred, the more in pain they are, the more infirm they become, the better the class was.
Well, but the thing that you have to think about, because I also worked in a doctor's office, I would get some of those people who were doing those exercises wrong, and they would have frozen shoulders, they would have torn rotator cuff muscles. There was one man that I worked with, he couldn't lift his arms higher than that.
Right.
So if you're tightening your shoulders so much, I'm strengthening them, but I can't lift my arms up, that's not very healthy.
Well, you're touching on something, and we both work with people with injuries.
Mm-hmm.
For a long time, I worked with people with injuries, and honestly, I've cleaned up a lot of people's messes.
Yeah.
And I've always found that there's something in our culture, particularly now, where it seems that the trend for exercise is coming directly from the military.
Yes.
You're literally having exercises called boot camp. You have these obstacle courses and things that are coming from the military. And I don't want people to think, I have trained in some of the most sadistic, some of the most arduous systems on the planet. And to me, you have to know why you're doing those things. I wanted to reach a certain level. And when you test yourself a certain way, you know that there are consequences. I've broken my hand, I've broken my foot, broken my hand actually more than once, both of them. And you know that there are consequences for this. And even in the 20s, I would say that if you're not careful, you're setting yourself up for problems in your 30s, your 40s, your 50s, and 60s.
Absolutely.
Some of the damage you do, like cartilage, doesn't grow back. They say it regenerates 75%, but I personally wouldn't put my cartilage on the table and hope that it's going to come back.
No, I agree with you, and I feel like I'm a perfect example because of my dance career.
Right.
I have knee problems, but because of my practice, I have not had to do knee surgery.
Yes, we are.
And I have to work on it, but it's not about doing heavy-duty quad exercises. It's really working about balance and getting balance of my legs, working in alignment and core, and I feel great. But I work at it all the time.
See, you're touching on something that is not really popular. It's how you feel.
Mm-hmm.
People are not really investing on their own information. They're abandoning their own information. How you feel during an activity means a lot.
Mm-hmm.
How you feel after an activity means a lot. Not to say that what we do doesn't have discomfort, but you have to learn to differentiate discomfort. I call it good pain and bad pain. You have to know when you're doing something that just isn't good for you. You have to know when to say stop.
Right.
I know you set out to run the entire marathon, but you're on mile 13 and your body's giving you signals like, this is not good, this is not going to be good, stop. We're not in combat.
No.
We're not in the military where those kinds of exercise routines are viable because those young men and women will go out there in an environment that's completely unforgiving. But for health and fitness, I think the key word is balance.
Yes.